Thanks, everyone. Thanks for joining this afternoon. Sorry about the technical difficulties. We'll get started here. There's a couple more people in the waiting room, and we will get started. All right. Stacey, you want to go ahead and get started?
Yes, thank you everyone for joining us for part 4 of our Urban Rodent Control series. Before we get started, let's go over a few webinar rules. Please, everyone, mute your line. You can use the chat box to ask us any questions. For any additional questions not answered during the webinar, please email them to us at education@nola.gov. This webinar will be posted on our YouTube channel, which can be found by searching New Orleans Mosquito, Termite, and Rodent Control. This webinar is in collaboration with the Gulf Vector, which can be found at www.vectoroutreach.org. Today's topic is going to be rodents, why control them, and their role in public health. A comprehensive look at the risk of commensal rodents poses to public health and the ways to increase preparedness. What makes rodents good agents to transmit disease to humans? Diversity of species, about 2,000 species are out there. Opportunistic nature, high reproductive potential, high population densities, and peridomestic affinities. Today's speaker, who will speak more about those issues, is Dr. Claudia Rigo. She earned her degrees from Purdue University, the University of Georgia, and obtained a PhD from the University of Florida. In 2004, she became principal research entomologist for the City of New Orleans Mosquito and Termite Control Board. In 2006, she became assistant director, and in 2010, she was promoted to director of the department. And now, Dr. Rigo.
Thank you, Stacia. Thanks, everyone, for joining today. And so today I'm going to talk a little bit about diseases and the really importance of rodent control on protecting public health. But just a little bit of background on our organization. We're the City of New Orleans Mosquito, Termite, and Rodent Control Board. We've been around for many, many decades doing mosquito work, but also rodent work for all of New Orleans. We have a pest management program that covers, we do all the treatments and for green spaces and city buildings. And we have quite a robust termite program at our organization. So today I'm going to be talking about rodents, of course. So let's get back to the basics. And Rodentia is the largest group in the class Mammalia. So it comprises about 4% of all species. So quite a few numbers of rodents in those groups. Humans and rats are two of the most adaptable and geographically diverse mammals that are out there. So sort of working, or at least one opportunistic, as Stacia mentioned, on some of the resources that we're providing these rodents. And again, we've coexisted for tens of thousands of years. And so this is why they're called commensal. So we're sharing one's table here. We're providing what they need: housing, water, resources. So first in this presentation, we're going to be talking about the commensal rodents, which are the nori rat and the roof rat and the house mouse. So if you've watched any of our biology webinars, we really go into detail about these animals. So I'm going to skip that really here for today. And here's the house mouse. I would say pretty ubiquitous. I don't think I know anyone that hasn't had some sort of interaction with a house mouse, either outside or in their home. Someone always has a story. And they're also considered a commensal rodent. Now, because we're talking about diseases, there are other species of rodents that are very important, specifically the deer mouse and the white-footed mouse in the context of what we're talking about today. So it's very important that you know your natives and your non-native rodents that are in your vicinity. And so again, this is just an example. It's a little bit of an older slide from 2016, but we had a big project with Tulane University, Dr. Mike Blum and his group, and we'll talk more about it in this presentation. But we did a lot of trapping as a group, and so we have a pretty good idea of where the Norway rats are in New Orleans, as well as the roof rat, and of course some of our native rodents were found in our natural areas. So very important for everyone to know in your geography, what rats and mice do I have? So, we mentioned this already, and, what makes them good agents to transmit diseases to humans? Well, there's a diversity in species and their habitats. We can think about this from a global standpoint. There are many different types of rodents, mice, rats, that can transmit a lot of different diseases, and they really fit a lot of those environmental niches where they can be found. Incredibly opportunistic, especially these commensal rodents that are living around us. They're utilizing our pet food that we're leaving outside or ornamental and fruit trees that we're putting in. And they also have a very high reproductive potential. So if you've got food, water, harborage, they're going to make babies and they're going to put them out into the environment. So very important. We've talked about control already, and actually next week, at least the fifth installment, we're really going to be focusing on control and how do you actually impact that reproductive potential? And that's by stressing them out, right? Removing the food, removing the harborage. If unchecked, they can have very high population densities. I think you can actually go on Google and YouTube and search many of the farms. There's some really great videos out there where there are just thousands and thousands of mice that are in basically mostly animal husbandry, but also you can have high population densities as well as grains come to harvest, and that becomes a big issue. They're also paradomestic, which means they are living around our houses, in our houses. So very important, and we provide what they need. A couple of things in terminology, very important here, are zoonotic diseases. They're, they are diseases caused by infections that are shared between animals and people. So this is a graphic representation from CDC, and it doesn't need to be only rodents. I mean, it could be a cat, it could be a rabbit or a turtle, deer, for example, bats or another birds, and they are moving between people and animals. So I think it's important for us to look at what potentially some of these cycles, right? Zoonotic transmission that can happen. So this is just a representation. We modified it a little bit. You could have an arthropod, right? Which is very important. So they're going to be an arthropod-borne type of disease. Maybe there's a virus that is being transmitted, a mosquito and a flea in this particular case. That life cycle will have that vertebrate host. In this particular case, it's a rodent. You've got that pathogen that's cycling between the rat and the flea in this particular example, but we may be out interacting in the environment or in an area with a rodent infestation. Maybe there are fleas on those animals, and we happen to be that incidental host that becomes infected and potentially symptomatic. All right, so what are some examples of vectors? So there's lots of different ones out there. So mosquitoes and flies and ticks and kissing bugs, mites and lice and fleas, those are those arthropod vectors. But also rats can directly transmit disease. Mice, raccoons are another one. There's lots of different parasitic nematodes. Bats would be another great example. So, and how does transmission potentially occur, especially with rodents in this particular case? They fit the bill for everything. And so let's talk a little bit about direct contact, and that's coming into contact with saliva, blood, urine, mucus, feces, or the other body fluids of an infected animal, in this particular case, a rat. So it could be a scratch or a bite, for example, so that could cause a lot of issues. So that's direct contact. You can also have indirect contact, which is you're coming in contact with an area where they live and roam. So if there are some of our pest management professionals, our friends there that work in pest management, you might be going into an attic or into a basement, for example, that has a lot of rodents? What about our environmental health specialists that are doing restaurant inspections or any kind of building for that matter? So you may be coming into contact with an area that's been contaminated. And so we're going to talk about some of those diseases as well. What about vector-borne? Again, they fit the bill on that one. And you could be bitten by a tick. In this case, mites and fleas are also common on rodents that can transmit some of these diseases. And foodborne, again, with rodents and foodborne safety, this is a big issue. We're going to talk about it as well, but you could be eating or drinking something that's unsafe, that has been contaminated with the feces, perhaps, from these animals. So when we think about, what are the problems, right, that are caused by urban rodents, we can think about contamination of food. So food safety is really super critical. They can also do damage to property and chew wires, for example, potentially cause fires. But just recently I saw a sidewalk that was caved in because of rodent activity underneath it. Disease transmission, we're going to talk a lot about that today. We're also going to touch on asthma, especially in children. And it just doesn't look very nice for a city. No city wants to be known for having rodents. And in the commercial arena, like, of course, contamination of food. This is a grocery store, just a photograph. I have no idea if it's has any kind of rodent activity or not, but it does really depict the different areas that we need to be concerned about. If it's pet food or the bakery or the equipment that is there, that is very common. The refrigerators that are warm, those are places where you might have damage. And of course, you're going to be doing damage to the units itself, but contaminating the food, potentially disease transmission, loss of productivity. Let's say a restaurant or a food establishment gets shut down. You're going to have regulatory violations, and you're also going to have productivity. So money isn't coming in. And of course, that very much is a big issue with shutdowns, fines, loss of customers. No, everybody's carrying a camera with a video, photographs, it goes online. And, it seems like that gets a lot of coverage. So there's a real potential for negative financial implications for these organizations. A lot of people live in cities, and that is only growing, honestly. So urbanization and population growth is a big issue. And accelerated urban populations can result, of course, natural birth rate, but people also moving from more rural areas to urban centers. And the more dense those cities are, potentially the more problems there are going to be with rodents. That's more trash, more everything, closer living conditions. This happens to be New Orleans. So what could potentially be contributing, right, to these urban rodent issues? Of course, that selvatic frontier, so land encroachment. People like to live in the woods, right on the edge of the woods. And I mean, you have to think about this from a global standpoint as well. So we are infringing, right, on some of these spaces in the woods, and potentially moving into these areas. You've got population growth. We've talked about that already. In many places, there's a lack of infrastructure and even resources. So maybe systems are old. I mean, New Orleans is an old city with old sewer lines, and that potentially can be a problem if there are breaks in the line. Increased poverty, poor hygiene, levels of hygiene, that also will create additional issues. There's not a ton of data in the United States to resistance and rodenticides. There's more information in Europe about potentially what is happening there. Now, we appreciate everybody's on the line today, and there just isn't enough expertise or training in this particular area, particularly in rodent control. And we need our public to participate. And that includes, residential as well as commercial. And in some places, again, another contributor could be climate change. I mean, here in New Orleans, we're already pretty hot, and we've got roof rats and Norway rats. But as the temperature gets warmer, potentially you've got roof rats that are going to be moving north and expanding their territory. Now, just to complicate matters a little more, right, is this happens to be a picture of the flight plans, or at least where the airplanes are flying from place to place around the world. So I could be here in New Orleans today, and in 12 hours, I'm somewhere in Africa, potentially on vacation, for example. And I could be in Europe or Australia in 24 hours. And so a lot of times what we need to worry about, and if you're working in these programs, is what potentially may be coming into your territory, your jurisdiction, the area that you're working in. So we have to look a little bit beyond, the borders of where you work in the event that someone goes on vacation, come back, they always seem to get a fever, not feeling really well. They need to make sure that they told their physician that they traveled. And we want to make sure that we're not infecting our local population of, in this case, rodents, but we also work with mosquitoes as well. So I'm going to talk very briefly about allergies, right? And what is an allergy? It's an overreaction of the immune system to substances that do not generally affect other individuals. So I know lots of people, kids particularly, that have gone, and you can go do the prick test, for example, to find out what you might be allergic to. And mouse allergen happens to be one of those. Symptoms can be sneezing and coughing and itching. You can have actually chronic conditions as well. But unfortunately, you can have very acute reactions, and they can be pretty mild, but in some cases, very life-threatening. So folks carry EpiPens and all of that. So what are some of those examples of allergens? Mosquitoes, ticks, stinging insects, for example. We have to know here our employees who have stinging insect allergies. Some have wasp, allergies, and some have bee allergies, for example. Dust mites are another. Rodent and cockroach allergens, also very common. So just as the paper, and you'll see that there's lots of, peer refereed journals that I refer to. It's a great opportunity for you to take a snapshot and read those papers and learn more about what I'm talking about. And so this particular paper back in 17, this is an inner city school, and they were looking at asthma increases with levels of mouse allergens. And so they went through, they did the environmental collections, did the analysis, and what they also found is that there was a decrease in lung function as those allergens increased. And so in schools, these urban centers, unfortunately, sometimes buildings have pretty serious infestations of rodents and other pests. And our goal here is to keep these kids in school sitting down. So it's very important, if you do have a school, that you are doing the best pest management you can. So why do we care? Well, I already told you about some of the reasons, right? But we're going to really start getting in depth about why it is so important for us to do proper rodent management and keep those numbers down. Of course, mice and rats are responsible for more human illness and death than any other group of mammals. There's about 61 diseases that affect humans, which rodents serve as a reservoir. Now, this is global, so not just here in the US, but again, remember, you might have that pest, that vector in your area, and we need to understand what is going on elsewhere. So, to complicate matters, there are diseases that are directly transmitted by rodents. And so pulmonary virus, you've got hemorrhagic fever with renal syndrome. We're going to talk about that in a little bit. Lassa virus, that's another one in Africa. Leptospirosis, LCMV virus, for example. Plague, there's a bunch, right? Salmonella, for example, tularemia. There's a bunch that are out there that are directly transmitted by those animals. Now, there are some that are transmitted indirectly by rodents, and that's going to have that vector that is there. So it could be a tick, a flea, a sandfly, snails. We're going to talk about that as well, and mites as well. So not all of these occur in the US, but it's important, again, to know what they are. And so just in the news this year, this was pretty amazing. I think everybody was watching what was going on with Gene Hackman and his wife. That, was it a nefarious? Was there, something going on? But as it turned out, his wife, Betty, had actually died of pulmonary syndrome. So I think everyone was watching the TV saying, my goodness, how can that possibly be? They have this multi-million-dollar house, but they were in the geography where it's not common, but it does happen. So some basic things, for cleaning, and we're going to talk about it, that may have been able to save her life. There was another big case back in 2012, if you all remember. It was at Yosemite National Park, and people were staying in the cabins that were there. And unfortunately, they had an infestation, and you had 7 people that became very ill, with 3 deaths of hantavirus as well, the cardiopulmonary syndrome. So that was really an unfortunate situation. So what is it, right? So there's 2 different forms that we see here, these hantavirus infections. There's the hemorrhagic fever with renal syndrome, the HFRS. We'll talk about that. And then there's also the cardiopulmonary syndrome, the HPS. And so the hantavirus can live without causing symptoms to several species of rodents, and eventually they pass by exposure to the urine, feces, saliva of infected rodents. And, to be honest, there's also been cases of hunters, for example, out in the Southwest that became infected with the HPS version, where they weren't wearing the proper gear, they were skinning the animals, processing those animals, and eventually they got pretty sick as well. So what are the symptoms? They're a little bit different. So the hemorrhagic fever with renal syndrome, those are stool virus. So those are new world, and we're going to talk about that. And those are primarily found in Norway rats. You're going to have potentially headaches and back and body pain and fever and nausea, kidney failure. Deaths can be anywhere between 1 and 15% of those cases. The thing is, very important, again, if you're working in this arena or if you know of exposure, most physicians aren't going to say, oh, let me test you for, a hantavirus today. So we really need to educate our public, our I would say professionals that potentially could be exposed, that they need to say something to the physicians. Very important. And then when you talk about the cardiopulmonary syndrome, so the primary host here is the deer mouse, and muscle aches and headaches. You can have difficulty breathing, respiratory problems and failure, nausea, vomiting. Death is around 36% of the folks that are infected. So, and unfortunately, things can happen very quickly. So it's really important to make sure that there is some sort of communication. And we're going to talk about cleaning up droppings so that our public becomes less, at risk. Soul virus is the old world hantavirus. I think I just misspoke on the other slide, sorry. And it's maintained in Norway rats and causes potentially a mild form of hemorrhagic fever, right, with that renal syndrome. Again, everyone's going to be a little bit different on how they respond. We've actually done work here in New Orleans, and the publication is at the bottom. And what we found, actually, this is several years ago, back in 2014, so it's been over 10 years, that in the 178 rats that were captured and tested, we found about 3.4% of those rodents had this virus in the system. So again, what it's showing here is that it's endemic, right, to our particular area. And human infection and disease, though it's kind of unknown, is prevalent in the population of rodents. So again, you can refer back to the paper, but we did find cases in the rodents that we collected. Now there's a map here. This is taken directly from CDC, and it's a map of the US with the number of cases of hantavirus disease that were detected. So this is from 1993 all the way to 2022. And you can see, depending on where you are in the country, those cases really increase. And so especially that California and Southwest region, Texas, those are I would say, west of the Mississippi River. That's where you're going to see a lot of those cases of hantavirus. Whereas on the east side, of the Mississippi River, right? So you're going to be from Louisiana all the way up to the New York, and the New York would be an example. You're going to have less cases that are detected. Now, what we should be telling everybody, right, even if you detect those cases, is that you have to know how to clean up those droppings. We've already talked about how if you've got a situation that a house, a building, structure that is infested with rodent droppings, somebody coming in potentially is exposed. And so we need to make sure that we're communicating how to clean up droppings. The Centers for Disease Control and Prevention has a really excellent webpage that has all the different ways that you can be cleaning up droppings. It could be anything from a car to a basement and all of that. But what we've done here is take some of that information and just make it very brief, where people need to wear rubber gloves. They need to wear face respiratory protection as well. Use a 10% bleach solution. We do not want anybody sweeping things up or vacuuming them up. That's going to aerosolize those materials, and unfortunately, somebody can inhale them and then potentially get sick as well. So if you see any of these social media posts or outreach materials, you can find us at NOLA Mosquito. We're on Facebook and X and Instagram, things like that. But those are places where you may be able to see it. We've also done this in several languages as well, so that you're reaching a greater audience. All right, so what about rat bites, right? So I think a lot of cities may track this, or you get notified of them, but unfortunately, I think a lot of folks do get bit and it never goes anywhere outside of their home, or maybe they will go to a physician. But there's an estimate here of about 20,000 rat bites per year. I suspect that's very much underreported, because not everyone really knows that they probably should go to the doctor or call somebody. And, we really don't know what sort of that impact really is. Now, unfortunately, folks that have less mobility, such as kids and maybe older adults with mobility issues, are particularly subject to rat bites just because they can't move out of the way. There's really two tragic cases here. One is incredibly tragic. In 2009, in the metropolitan area, there was a case of a baby that was killed by rat bites. It really, honestly, it was hard to believe that was the case, but that really was the diagnosis of the coroner of our neighboring parish. And, I ended up looking at that structure down the road, at least from the outside, and it was under construction, so it was very leaky. So it's really important that, parents know, don't put your kids to bed with a bottle, for example, or, feed anyone in bed. So areas where you may be sleeping. Wash your hands so you don't have those food odors, which really leads me into the next story of, this is when I first got here working at the city of New Orleans, and there was an elderly woman that lived in a house. She had some dementia issues, and her mom and her daughter lived next door. So everything was clean. They kept the house clean, but it was a raised home, and there was an entry points into the house. And the mom would get up, eat something, and that next morning her fingertips had bite marks on it. And she didn't, have the means to call her daughter or anything like that. But again, those folks that have limited mobility are often very much at risk. So what is rat bite fever? So this is a bacteria. There's two different ones that are really implicated in it. And they're found in their teeth and their gums of many rats, and they can be transferred from a rat to a person by a bite. And I will say this though, if you are scratched, you should make those assumptions as well, that you need to have medical care. Some symptoms that are caused by these two types of bacteria is fever and vomiting, headaches, muscle pain. You can have joint swelling as well. Here's a picture of a rash, for example, that might occur in these severe cases. And typically, cases are going to resolve themselves, but potentially, I think most physicians are going to be prescribing some sort of antibiotics. But again, that's based on everybody's individual cases. But if you know someone, or if in your particular jurisdiction, they should absolutely be reporting any kind of bites and scratches to their physician. Food safety is huge, right? And so we want to make sure that everybody is not eating contaminated food. Many of you are likely work as environmental specialists out there, food health inspectors. So there's a lot of things that we need to worry about, of course, but we want to make sure that these animals, rodents specifically here, are not transmitting salmonella or campylobacter to the food that we're eating. So very important. It can cause acute gastroenteritis, really bad stomach aches, you're really sick, nausea, all those things. And again, food contamination, incredibly important. And so there's papers here that have talked about it and really what that economic impact is, but also from a disease standpoint as well. This is back in 2009. This is a story that sticks with me, but there are others. There was a case in Georgia of a plant. I know that they dealt with peanut butter and other foods that they were processing, but as you can see here with a little arrow, there were a lot of food safety issues that were broken, and they also found cockroaches and rats and other kinds of issues. 9 people killed, 700 people sick, and 42 states were impacted by the contamination, and rodents were implicated in that as well. So we're going to keep moving through some of these diseases. There are a lot of them. We're going to highlight the ones that I think are pretty important, the ones that you should be, I think, concerned about in our region. And leptospirosis is one of them. It can be from a very mild to severe infection that can be fatal. These are the bacteria as well. And how do you get this? And it's human cases result from direct or indirect contact with infected urine of rodents, and actually some other animals as well. It can be found in food, water, and you may have an abrasion on your skin, for example, or a cut, and walk through water, often in floods, and that's how that bacteria is going to get into your system. Now, in the United States, we don't have thousands and thousands of cases, and it's not terribly common that people die of leptospirosis, but this is one from last year, 2024, in the southern part of Brazil, and big floods in that region. And unfortunately, there were a lot of cases and deaths as well, which really leads me to that leptospirosis is the most widespread rodent-borne disease in the world. There's over 1 million cases, almost 60,000 deaths a year. The source here is the WHO, and these are reported cases. So there are likely more than that, but those are the ones that are here. And so again, you can go into, there's lots of great resources, this publication that talks about the global outbreaks from 1970 to 2012. And you can see this is really a global disease in those temperate and tropical and, in areas like in the US, all the way up in the northern part of the US where there's been outbreaks of leptospirosis. Now, this is a relatively recent article, I would say 2017, and there were 3 cases of leptospirosis in a city building, and this is reported by the New York City Health Department. And again, New York City in a building, right? So there had to have been an infestation in those buildings, 2 people ill, 1 person died. And again, it's really making sure that our physicians, that our public health folks, they really understand, what to ask. Is there a rodent infestation? If you're working in this arena and you have symptoms, for example, maybe a patient comes in with sort of those fever, whatever it may be, those generic type symptoms, you really do need to ask the questions. Do you have a rodent? Have you seen rodents in where you live? Maybe it's a mosquito, that you need to ask about. Have they traveled? And so again, you could become infected through those skin abrasions, through your eyes, your nose, a cut, for example. High fever and red eyes, abdominal pain. Those are very generic style, I would say, symptoms. You can absolutely survive leptospirosis, but again, very important. And a lot of people aren't going to have hardly any symptoms. Again, very dependent on the person's immune system, what is going to happen. But those very serious cases, it is incredibly important, right, for people to make sure that they're receiving treatment. And what can happen? What kind of treatment options are out there? Hopefully, it gets to the point where if you are showing those symptoms, it's just antibiotics, right? But again, that's going to be between you and your physician and your medical history. In those very severe cases, you can have fluids that build up in your lung, and they may need a mechanical ventilator, for example, to get you through. And there's also the risk of organ failure. You may have to have plasma exchange in that procedure as well. So again, physicians may, if you have very mild symptoms, maybe over-the-counter medications such as ibuprofen, naproxen, even acetaminophen, all of those are out there to reduce the fever and pain. But the whole point of the story here is that if you suspect leptospirosis, please seek medical attention and work with your physician for the best course of treatment if needed. This is a paper here, again, our collaboration with Tulane University and the Mike Blum group. They're now at the University of Tennessee, but there are a lot of publications that have come out of this work. And as you can see, in the areas that where we trapped, it seems like if you look, you find. And that's exactly what happened. And so the larger the dots, the more prevalent, but leptospirosis is found all throughout the trapping areas here in New Orleans. The other thing is that they're also prevalent across the different species of rodents. And so again, it's not ubiquitous or unique, I would say, to a Rattus rattus. I mean, we're finding them across our different rodent species that are found in our area. Which really leads me to, right, there are lots of different species of Leptospira, and the distribution is going to change, right, depending on the species and the rodent species, but you can also get them into different animals, deer, dogs, for example, cows. Those are some of those other animals that can be, where you can find Leptospira. So I will throw it out there. I have a cat, right? But maybe your pet, your dog, is sleeping in the bed or is licking your face. Those are all avenues, right, where you potentially could become infected. So one of the things we've done here is New Orleans is, as you many all know, we're very prone to flooding. And so we use this particular post to say, what is leptospirosis? And or if you have a flooding event, for example, we're below sea level. So, and it rains here sometimes 8 or 9 inches in like 2 hours. It's incredible how much rain we get here. And so you can actually have water that accumulates until the drainage system catches up. And so we really want to let people know at a city level, avoid contact with any kind of flood water. So this is just a great example here where somebody is wearing boots to walk through the water instead of sandals or barefoot, whatever it may be. Make sure your open wounds are covered. And again, that gear is incredibly important so that you're not getting exposure. All right, so let's skip a little bit. We've talked about bacteria, so now we're going to talk about nematodes. And so, frankly, one of my favorite. This is Astrongeles cantonensis. It's called lungworm. It's a parasitic nematode that is transmitted between rats and mollusks. Really, those gastropods is what you're talking about, such as slugs or snails, also involved in the natural life cycle. But there are other, animals that become infected. There's freshwater shrimp and land crabs, frogs, for example, planaria are other examples. And so we need to really be very careful about making sure that we cook our food. Other examples of nematodes would be trichinosis, for example, in pork. So make sure that you're cooking your food so that those nematodes are killed anyway. But unfortunately, humans are the accidental host. We do not transmit infection to others, which is very important to know. But this is what this life cycle looks like. You can actually see the larva there of the nematode, and this comes from the CDC. So the life cycle, the natural life cycle, you've got the rat, the nematode, of course, and there's different larval stages. But they get into the snails or whatever gastropod that of choice. And unfortunately, maybe somebody eats something, right, that's infected, or they eat a snail or whatever it may be, produce that's contaminated with those secretions. And now that nematode gets into our body and it can really cause a lot of havoc. So unfortunately, with this particular case, if you consume it, the larva is actually able to move through your digestive system. It gets into potentially your brain. And that's where you could have meningitis encephalitis. It's pretty bad. And unfortunately, it does cause death in some cases. We actually had a case that we suspected in a neighboring state. They had the rat infestation, they had the community garden, they had all the symptoms. So we're not 100%, but it seemed like it was pretty close. Depending on where you are in the world, it is relatively common. Southeast Asia, Pacific Islands, some parts of Africa and the Caribbean. So again, many of us travel, we move around. So you really do need to stay very much in tune on what you're eating, and making sure that your produce is washed if you choose to eat it in some of these locations. Now, I'm talking a little bit about this. I already mentioned community gardens, right? But I want to throw this paper in again from the same group, is that New Orleans is still recovering. It's made a ton of progress, but there are still some locations that have lots that have overgrown grass, or maybe a house that hasn't is still there. And so they did look at the prevalence of rodent, looking at that abundance and what is happening. And so it seems like a no-brainer answer, but sometimes it's great to have the scientific data behind it. But yes, when you have these lots with high grass, it absolutely, you see a higher abundance of rodents with often a higher diversity. Now, which is great in some of these communities, especially in cities, is that some of these lots turn into urban gardens. And so here's two people, which is great, right? Produces fresh food. It provides an opportunity for people to work in the gardens. But we need to really be careful that we're not just exacerbating rodent infestations. And so again, there's a whole thing you guys can do, or just educate your public on picking up the fruit, keeping things clean, reducing those risk factors. But this is the big one, is improper composting can lead to a lot of problems with rodents and pests, even flies, right? Mosquitoes, for example, with water buckets and all of that. So please make sure that if you are composting, that you know how to do it correctly, what is allowed in composting, so that you get the best results and minimize the problems. So again, I'm going to bring up New Orleans. All right. So here it is. So there was a case back in the 80s. It was a kid actually that became infected with lungworm. And so back again from this project, let's take a look and see what's going on. And it seems like every time you look, you find. And that was the case here as well. So they looked actually in the rodent themselves, about a 38% prevalence. And of course, it depends by area that was trapped, host species, all of that's very important. But it's here in our area. So then we really should be educating our folks on what to expect and how to prevent. So lots of traps, lots of rats were trapped, several species as well. And you can see that in roof rats, yes, they're there. Norway rats, yes, they're there too. Some of our native species as well. We didn't see any in rice rats that were found in our areas. So again, very important to stay on top of things. All right, so here's another one. This is Bartonella. It's a gram-negative bacteria. Symptoms can vary to be very chronic, serious, and or you can have honestly some mild symptoms as well. There are many species of Bartonella out there. And again, we were testing here in our particular area. Flea infestations, very, very important in this life cycle. And again, gram-negative bacteria, it can cause, in some severe cases, inflammation of the lining of the heart. You can have inflammation of the heart muscles. You can have acute vision loss in these very severe cases, enlargement of the spleen. You can have meningitis, for example. So of course, we see all these words and I'm like, oh, what do they all mean, right? What inflammation is it? So that's part of the reason why I put it out there. It can get confusing. But there are a lot of rodent-associated Bartonella species out there. I think the one that we always think about, at least the more common ones, is Bartonella hensley. Actually, that's cat scratch fever. So that's not so much rats, but that's cat. But that's the one that I think most people are aware of. Now, what's their distribution worldwide? Well, pretty much everywhere, right? As well, there's lots of different species out there. So again, and in many of them, you're also going to see that with their flea ectoparasite, that association with the flea ectoparasite. And in this particular graphic, you can see that prevalence is where. So pretty high and very, very, I would say ubiquitous around the globe. Fleas are considered really important players in the Bartonella life cycle because they are going to harbor a higher diversity of the Bartonella species. And in fact, in New Orleans, we've seen sort of the preliminary work. We've seen multiple species of Bartonella associated with that flea in that rat from one animal. And they're very efficient, these fleas here of transmitting a transmission of these bacteria among the rodents. So they're very important, these fleas, as not only the vectors, but they're also serving as that reservoir for those bacteria. And again, let's look in New Orleans to see what we find. And hence, if you look, you find. And here it is, right? So same rodents that were collected. Fortunately, the team, this case, Anna Peterson, she was a graduate student at the time, was able to look for a variety of those pathogens. And again, pretty much everywhere that they caught rodents and the fleas, there they were. So this is a very big one, and this is an important one that everyone really needs to be paying attention to. And this is murine typhus fever. Rats are the reservoir for this flea-carried illness, very important. And our oriental rat flea is another very important vector of this disease. It's a bacteria as well. It enters the bloodstream when the feces of these infected fleas are scratched or rubbed into a flea bite or a wound, for example. A break in the skin is another one. So there's lots of different ways that those bacteria can gain entry essentially to your body. Here's one of the bacteria, right? It occurs in the California, southeastern US, the Gulf Coast states. I would say, you do see cases of it, and I'm gonna show you here the prevalence here in a little bit. We talked about it already from the flea, in some cases mites as well, broken skin, very important. If people are inhabiting or living in areas infested with rodents, they're really most at risk of this disease. Encampments of the unhoused, for example. You may have an apartment or a house that has an infestation. Those are going to be, places of higher risk. Some of the symptoms, severe headaches, chills, fever, and rash. Again, if someone goes to the doctor, we must educate our physicians, right? Our first responders, the first people at intake, that they need to ask these questions. Do you have a rodent infestation? Have you seen rodents? Super important. And also it's been reported in travelers returning back from all different places from the world. So when you are traveling, I always do this, as I will go and see what are the pathogens or the vectors of concern, right? So that I can take precaution and make a decision if I'm going to be going to that particular location. And there are different fleas that are associated with flea-borne typhus, murine typhus, depending on where you are in the world. So, and again, you may have fleas on your dog. We're going to talk about possums as well. So you can come into contact, well, of course, with that infestation or with your pet. So very important to prevent fleas on your pets. Super important. And again, please make sure that you're going to a physician and reporting those symptoms. So I did a little bit of homework here from 1920 to 1967, and then all the way to 1987. These are some of the cases in the United States. Now, these are cumulative, and I just really want to point out the number of cases really from 1932, right? Where we're in some cases over 2,000, almost 3,000 cases, 1942, almost 3,800, 1943, almost what, 4,500 cases, and it keeps going up. Now, fortunately, it started going down back into the 50s. And actually, here in New Orleans, there's a paper all about this. They did a big project along the lakefront where the rats were, I mean, there were many hundreds of cases of murine typhus here in New Orleans. And so they ended up doing a huge campaign in the 40s. They ended up doing another one in the 1970s to really push those numbers of rats and fleas down to prevent that human illness. Here in Louisiana in the last, decade-ish approach, right? So we've had some cases, not very many, 5 or so is the highest in 2014, but we need to really pay attention. Some of these were in the western cases or western parts of the state. We actually had a case, I think it's 2 years ago, associated with a cat as well. But we need to look in the rural areas that possums and fleas are really that driver. In those urban spaces, we've got rats and fleas here and people. Now, I want everybody really to start paying attention onto what is happening here, especially in Texas, Galveston County. There's other locations as well where you have cases of murine typhus. They've been identified. And again, you've got different animals that are involved. In this particular case here, we've got lots of cases of typhus from 2000 to 2022. And those are pretty high numbers, honestly. And again, we've got different vectors that we need to worry about. But in Texas here, within that time, around 6,500 cases. In California as well, especially in areas with unhoused communities, again, very important. Los Angeles has had outbreaks of typhus. Very important. It's actually spread to, actually, there was a place that it spread to some folks that worked at their city hall and even in their downtown area, living into some of their housing that is there. So very important to maintain and manage rodents in your community. Now, a lot of times, and we do here in New Orleans as well, as we do work in those areas with unhoused folks. And it can often be a pretty difficult situation. There often are rodent infestations. So there's lots of things that can be done to help mitigate that. And it's usually, working with a variety of different agencies that work in these particular areas. And it's really tough, okay, to be honest, with rodents, because you are constantly having that food source. But again, we need to continue to make inroads. PPE is personal protective equipment is very important for people that are in there. Obviously, there's the needles and the human waste potentially, but also we need to make sure that people that are doing the job that are in there are minimizing their risk for infections. All right, so LCM, right? So a lot of times it goes under LCMV, so lymphocytic choriomeningitis. It's caused by a virus. Again, breathing in dust that's contaminated with urine and droppings. You can also get it by direct contact. That's pretty rare. Bite wounds are pretty rare in this case. You get flu-like symptoms, and the driver here is going to be mus musculus, our house mouse. So healthy people are usually going to recover. You're not going to even know that you have it. It might be a situation where you have flu-like symptoms, not feeling very well today, and then people recover. Where it gets to be pretty serious is that people that maybe have weakened immune systems, pregnant women, there's some real big issues that can happen with the fetus. And so very important, again, for our professionals, I always say we go into the fire, right? So we're going into those areas that are infected. So it's really important that you're wearing your PPE, you're showing people how to clean up droppings correctly, keep those good environments. There are some studies out there. This is pulled from the CDC. Anywhere between 2 and 5% of people living in urban areas have a past infection, and they never knew about it. So pretty amazing. Now, what is incredibly important here is through organ transplants. And so this can cause death. It can cause a lot of problems. There was a case here. There's a publication, pet rodents actually caused a fatal case of LCM in a transplant patient. Okay, so again, you might think, oh, that pet mouse, it's all good, right? You still need to follow good practices and cleaning and washing your hands and all that things that go along with good sanitary practices. So transmission, how do we get it? Same sort of thing, where inhalation, there's been a case of vertical transmission from mother to fetus that's been documented as well. What are some of those? You can have, look, you can have no symptoms, you can have mild symptoms, but then it can be bad as well. Especially for that fetus, you can have congenital abnormalities can occur, especially with those infections occurring early. Fever, nausea, loss of appetite, sort of those generic type symptoms, but it can be very important in some cases. All right, so sort of I think the last two more diseases I'm going to talk about, and we're going to talk a little bit about preparedness and how important municipal and state programs are for reaching some of this, and we're going to talk a little bit about mental health and what rodents can do and how they impact mental health. So Chagas disease is another, it's a parasite. It's transmitted by the kissing bug, depending on where you are. It's a different species globally. There are lots of cases, many, many deaths a year that occur. Hundreds of thousands of infected people as well. And you can, there are cases of locally acquired cases here in the United States. And again, we're in New Orleans, so let's look. And so unfortunately, we found. And so here's another group, same group, and lots of rats were trapped, about 1,400 rodents, about 11% of those were positive with T. cruzi. So, this is the rodent. And again, depending on the neighborhood that they were in, you had different prevalence. So what this should be telling you is that maybe some of this work hasn't been done in your particular area, but it's something to at least start educating folks to be aware of, right? And maybe there is some work where you have some of the follow-up and documentation, but bottom line here is all the different ones that we've shown is that you probably need to start talking about it or at least be aware that that's there. Now, I think I don't know about all of you, but I have probably watched every medieval plague movie that's out there. All right. And so plague is the big one. And so millions of people have died, and we'll talk about that in a minute. But your Yersinia pestis, right? The Black Death is sort of that disease. And so the reservoir rodents, transmission, fleas, bites, and through scratches as well. You can have lots of different symptoms depending on how, if you breathe it in or if you have swollen lymph nodes, for example. And depending if it is pneumonic, you can die very quickly. So very important treatment, antibiotics, at least that's available, which is great. Depending on where you are in the United States, prairie dogs are a big thing, right? If you're in California and those sort of areas where you have those prairie dog towns, they can really be a good reservoir of plague. So pretty important. So if you think about it, right, ancient Rome or, a bazillion years ago, people, again, we think about it in the movies, if we're watching Gladiator with how beautiful things are. But, the reality is they were overcrowded cities with lots of ectoparasites, and looking through some of what those people have written, they suspect a case, and there's more than one, but really an outbreak of plague in 165 AD, right? It's a long time ago. This has already been circulating. And, rodents were in there, contaminating food storage, flies, malaria is another that you would find out there. And only imagine how people lived with bed bugs, right? So bed bugs were a common thing, many years ago until some of our pesticides have been shown effective after World War II, but it was pretty common to live with all of these kinds of pests. And of course, if you look at sort of the origin of plague and then how it moved with merchants and people moving from the east to the west, and moving, unfortunately, plague with it. Estimated 200 million people had died worldwide in the 1300s pandemic. Anywhere between 25 and 33% of the population died in Europe. So that's a lot of people. And I am showing Oriental rat flea, but if you've been reading anything lately, they're also looking at potentially lice as one of those vectors for plague. So I don't think they've quite worked it out, but that's also something that you need to read a little bit more about. Now, out there, right? So let's say you're in a more rural area. Maybe these animals might be so there's maybe the bacteria may be circulating at low rates within these populations. They're not killing off those populations. Potentially, your pets, animals, even yourself become contact. And here's just a good picture of maybe a dog that's become infected or has fleas on it, for example, and that dog's sleeping in your bed and maybe that flea bites you, right? So, it's keeping that cycle going in these long-term reservoirs. That enzootic cycle is really important for these pathogens being sustained in these environments. Now, if you like to read about history, there's so much out there on plague. You can actually read that. There's a really great book on the plague in the first cases and how it was dealt with in San Francisco, for example, New Orleans, of course, in Europe. There's just a lot of different things that you can read about, which is very important. But there have been cases, right? And again, I mean, it can be in throughout Europe and Asia right now as well. So it's not uncommon, but there's some really great, interesting information about that. All right, so we're going to take a little bit of a jump from, we've talked a lot about these sort of major diseases that are out there. It's really important that, again, a lot of them have pretty similar symptoms, but ask those questions. Do you have a rodent infestation? Do you know the species of rodents in your area? Where potentially maybe there is some university work that's been done in your region to let you know a little bit more of the prevalence of these, I guess, documented cases or prevalence of these pathogens in your area. So, why do we care about rodents, at least from a preparedness standpoint, right? So you may have a hurricane or some other major disaster, and rodents are in the mix. Now, rats aren't going to be an issue immediately, but it is definitely going to be a concern, especially when there's a breakdown in trash pickup or things just start to accumulate. So we're going to talk about that a little bit. And hard to believe, right? But it's been 5 years with COVID. And many of you probably on this call have dealing with COVID. And when the shutdown was happening of restaurants and all of these other organizations, these animals that shouldn't have been there to begin with came out looking for food. And so again, you can have emergencies like that where you have the tools, skill sets, and you can pivot and deal with those animals. So there's lots of things that you need to be doing. And this is really the wish list, I think, of control, infrastructure that you need. But you need to know what species you have in your service area. You need to have a program, municipal funded. It could be municipal or state. An ability of your public to at least do reportings of sightings. Do you know what ectoparasites and potential disease or pathogens you have in your area? You cannot work alone. You really must have that interagency cooperation, information sharing, understand your infrastructure, work with your private sector, very important part. What tools do you have available? Public awareness, right? And of course, very important is that participation of the public. Now, after a disaster, a national disaster, it takes a little bit of time. So here, Hurricane Katrina came, and rats aren't, the issue immediately in areas, for example, that had been flooded. But there's some work out there, and there's some papers actually out of China where there has been flooding of fields, and they're able to really look also at how mice rebound over the course of time. And so it takes about 6 to 10 months after a disaster for that rodent population to really grow and, increase that exposure. And so those rats too, many of them have died. Many need to reproduce and grow, but the issue becomes is that if that food, the stuff, the houses are getting cleaned out, all that available food is there, and then it's population increase. And during an emergency, right, there is a role for them in the Emergency Operations Center. And I will plug our next webinar series. We are going to have a 5-part series just on emergency management, and that's coming up soon. So if you're interested, just make sure you reach out to education@nola.gov, and we'll make sure to put you on the email list. But we are going to be talking about the role of vectors, rats included. There was I'll tell you, right after Hurricane Katrina, a lot of rodent hysteria, a lot of sensationalism. It doesn't matter what we do, there is always going to be sensationalism with rodents. So make sure you know your facts, right? Because wrong information is often disseminated. And we as professionals need to know what that risk of rodent-borne disease is so that you can deal with the correct stakeholders. Understand your current conditions, right, with rodents if you have it. And then, of course, work with your communications department to disseminate that relevant, accurate, and easy to understand information. I'm going to give you the example that I just showed you on making sure that people are not exposed to floodwater. So those are really good. Now, there's some researchers out of Canada, Dr. Chelsea Hemsworth. If you know her name, you will know what wonderful work they do up there. And her and a group of authors did a literature search to look at the mental health consequences of potential rat exposure. And so, research suggests, right, that living in these urban areas you could potentially have poverty, aging infrastructure, high housing density. Those things are going to be contributing to potential rodent infestation, and there may also be a lack of resources to address those issues. And there are a lot of people that are reliant, right, on the actions of their landlords or even municipal agencies like us. Maybe they can't afford rodent control or, any kind of, and need the support for that kind of work to be done. And so very important to have these municipal programs. But what they found here is that rat exposure negatively affected the residents that live in these areas' mental health. So the awareness of an infestation or direct exposure really were stressors and really were drivers of anxiety among these residents. They also found another study that residents that were living with rat infestations had poorer mental health than those that did not have rodent infestations. And those rat exposures could trigger headaches and dizziness and even stomach aches. So it was really affecting even their just general health with symptoms. There was also work done in Baltimore, for example, with daily rat sightings and perceived rat infestations provided a greater, more depression than residents that were less frequently exposed. So very, very important. Another one, for example, on neighborhood level environmental stressors here, residents who had perceived rat infestations also as problematic, right, perceived as a problem, also lived on blocks with other indicators, such as vacant property. So there was often an association that was involved. And they also found a couple of studies that found that landlords' inaction, right, with dealing with rodent infestations, elevated the stress levels of these of their tenants. And so very important. And it could often result in verbal abuse or even threats of eviction. So I will say sometimes, people are in situations where they're afraid to speak up, right, of potential eviction. So this is a real big issue. So we've talked about this already, so I'm going to skip it. And so it sort of goes back into having these municipal programs in the United States. And so there's some work, and it's already 10 years old, but programs really can vary in size if they exist at all, right? Not every city is going to have a program, but many cities, especially the bigger ones, have the ability to take 311 calls. So this is just a call center. Funding levels vary tremendously. In some cases, it's a public organization that's doing the work, like us, or they'll hire a contractor. So very critical that those bid specifications are very clear and robust. Very important. Outreach programs, Some exist, some do not, but it varies tremendously. And there's lots of things with actually control and even surveillance. But what we find a lot is that people are working in silos. So I think the one thing that New Orleans does very well is that we meet and talk a lot about all different topics. And what's interesting for the City of New Orleans Mosquito and Termite Control Board is that we actually fall under the umbrella of Homeland Security. So we sit at the table when there is a planning for an event or a function or a disaster. They're looking, our mayor and our leaders are looking for what we are doing. And we actually have a seat at the table. So we're actually intern educating a lot of other organizations about what good rodent control is. Now, this is a graphic we're doing this through the Gulf South vector, and I'll provide the website here in a minute. But these are actually counties and parishes in our states that we're dealing with in our program where they actually have some sort of mosquito control program. And if you look at it from a rodent standpoint, not very many counties or cities have a rodent control program. So really lacking there in the support of that. And so we're working with some specialists here in rodent control, and we're created a work group, not only for folks in the US, cities like Chicago and New York and Boston and Mobile, New Orleans, East Baton Rouge, but we're working internationally as well with experts in Toronto, other places in Canada, Singapore, to create a work group where we can start to share our priorities and create action plans so that we can protect cities and people and animals. Now, again, I think I've said this a couple of times, but if you are working anywhere where there are rodents or doing rodent control work, you really must make sure you're wearing the right PPE so that you are minimizing your exposure. And so just to wrap it up here, I think maybe after the hour and 10 minutes that we've spent together, commensal rodents are not just a nuisance. Unfortunately, some people still believe that they are. They have a very important role in public health, and they can also cause a lot of economic loss. They are extremely good agents for disease transmission. They're very adaptable, opportunistic. They're hanging around us all the time. And there's a lot of historical and current data that supports the presence of a variety of diseases associated with rodents and their ectoparasite. You know, if you want to look at cases in your area, go to the CDC's website, go to your local state health department. They likely have that information in your region. Do a literature search as well. So wear PPE if you're working in these scenarios. And I'm just going to be an advocate here for state and local agencies need to have the infrastructure to manage their rodents. There's a whole group of people that will never call private industry that we need to make sure that we're mitigating the disease risk. I just wanted to give another shout out to the team at Tulane University and some other folks at the Forest Service, City of New Orleans. These folks now are at University of Tennessee, but it was a very large group of people that were able to do tremendous work in New Orleans to be able to get this information several years ago. So with that, I will answer a few questions and then we'll talk a little bit about our Rodent Academy that's coming up and a little about the Gulf South Vector. Astacia.
Hi, Claudia. Someone asked if you could go over the tips for cleaning up rodent droppings again, specifically the parts of bleach per water you should use.
Absolutely. So that's a great question. So we like to use a 10% bleach solution. So that's a 1 part bleach and 10-part water. Now, so these are often viruses and bacteria that you are using or trying to kill. So really after COVID, I would say it is extremely common to find different products that are on the market because not everywhere can tolerate bleach, right? So maybe you have fabric or it's an area with something more sensitive that would be affected by a bleach solution. So there are lots of different brands out there, but there's a couple things that you need to worry about. One, make sure that you read that label of that product Lysol, for example, is a great example, right? So if it's saying like kills COVID-19, you're probably okay to use that product. But you need to read the label and look at the dwell time. So what that means is how much time does that solution need to sit on what you're trying to disinfect, okay? And so that you're sure that you're going to kill those pathogens. It's a lot harder, it's a lot easier to kill bacteria, typically, depends if they have spores, things like that, but than viruses, but those typically will work.
Okay, thank you. That's the only question I see in the chat box.
All right. So with that, I just wanted two more slides. We have a Rodent Academy coming up here in New Orleans. It's going to be June 24th and 25th. If you are interested, there's the information below. There's a QR code. Snap a picture of it with your phone. But it's a 2-day course, very intensive, very hands-on, and we go over a large variety of topics. And so it's a good time here in New Orleans. And I also just wanted to mention here, really encourage everybody to go to vectoroutreach.org. This is a CDC funded project. We're a training educational center for the CDC. So I think many of you may have heard centers of excellence that are out throughout the US. We're one of those training centers. We cover from Texas all the way to Florida, but go to vectoroutreach.org. This will tell you a little bit more about this program, but also take a few minutes and sign up for it. That way you get notified about training opportunities that are out there. And if you have things that you want to advertise on training opportunities, there's a place for you to do it there. So with that, we really very much appreciate everybody for taking their time for attending today's webinar. We're going to be posting this on our YouTube channel. If you are local here in New Orleans, of course, if you see a rodent problem, please call 311 and report it to us. We do want to know. And to reach us at education@nola.gov. This will get you to Stacia. She'll put you on the email list so that you get notified of future events. And this presentation is used for educational purposes only. So with that, everyone, thank you so much for spending your time with us and have a great day.